Hello, today we'll look at Paliperidone, the intramuscular injection that we can give patients with schizophrenia. We want a more convenient way instead of giving tablets. We have been giving tablets for the schizophrenic patient for many weeks, and he's taking the tablet every day, that meaning 356 tablets a year. And now we decide that the patient is stable on the oral tablet and we want to stabilize this patient even more, and we don't want to consider compliance and so on. We don't want to talk with the patient all the time about taking the medication, please take the medication, because many times the patient forgets the medication and so on. So we want an intramuscular injection every 4 weeks, for example, or every 12 weeks. That meaning only 12 times a year or only 3 times a year. And that would be really convenient. Why? Because, not 3 times. Every 12 weeks means 3 months. That would be 4 times a year. So we can give it every 12 times per year or 4 times per year, depending on which type we have. Because we have 2 types of Paliperidone. We have this Paliperidone 4-week, which we call the trade name that is Invega Sustena. And then we have Invega Trinza. So this is the 2 combinations, 4-week and 12-week. And what dose of Invega Sustena do we have? So the 4-week dose. We have then 39 dose milligram, then we have 78, 117, 156, and 234. So once again, we have 39, 78, 117, 156, and 234. What do? We start with, let's say, 234. Why? Because in the first injection, we start with a little bit higher dose. Then after 1 week, we give a second intramuscular injection, and then we go down in the dose. So we give not 234 this time, but we give 156. And then 4 weeks later, we reduce the dose again, and we give another injection, and that will be our 117. And that will be our maintenance dose for every 4 weeks. We continue 117 then every 4 weeks. Why do we do this? Because we load the patient with a higher dose, because with this type of medication, this type of antipsychotic, that is Paliperidone, we don't need any oral overlap, we call it. That meaning the tablets that he took until now, he can stop them. He can remove them totally. Because there exists antipsychotics where we need an overlap. We call it oral overlap. Meaning you give oral tablets, you continue with that for 1 week or 2 weeks or 3 weeks, and you give the intramuscular injections. Here we don't need that. No overlap. Paliperidone, no overlap. You just stop the oral tablet and you give an intramuscular injection with 234, for example. 1 week later, then 156. 4 weeks later, then 117. Now we give 117 every 4 weeks continuously. Then, when can we start to give this Invega Trinza? That is our biggest shot. We have 12-week injections. That meaning we only need to give it 4 times a year. That will be the most convenient one, the most stable medication. When do we give that? After 4 months. We have to have at least 4 months of Invega Sustena, so this every 4 weeks, so at least 4 months. Then, if we see that he is stable on Invega Sustena for every 4 weeks, then we can start Invega Trinza with 12 weeks. And how do we do that? What dose do we give now? We had 117 every 4 weeks. That was our maintenance dose of Invega Sustena. Now with Invega Trinza, we take that dose times 3.5. 3.5 times 117 will be 410. So there exist 4 types of doses of Invega Trinza. First of all, we have 273, then we have 410, then we have 546, and then we have 819. Now, we had a patient, let's repeat it. He took oral tablets. We're fine. We say, please stop these today. I will give an intramuscular injection of 234 milligram of Invega Sustena. Please come back in 1 week. In 1 week time, I will give you an intramuscular injection now of 156. Please come back in 4 weeks. I will give you an intramuscular injection now of 117 milligram. Please come back in 4 weeks again. I will continue to give 170 milligram every 4 weeks. But how long, doctor? Please, at least 4 months. 4, 5, 6 months. Let's see how much we need to get you stabilized on this. Now you're stabilized. After 4 months, you're stabilized. What do? We take this times 3.5. So now I will take an Invega Trinza instead. That is having a dose of 410 milligram. I make the injection and voila. From now on, we can give you an intramuscular injection every 12 weeks, so every 3 months, with a maintenance dose of 410. And you would ask, but why do we need all these other types of doses? Yeah, it depends on the patient. Maybe he has a lot of kidney problems. Then you need to reduce the dose. So you don't start with 234. You start, for example, with 117. And then you move down to 78, and then you move down to 39, and the maintenance dose will be then 39, and so on. So the importance here is that you have a playground of different type of doses that you can use, and therefore you can stabilize the patient according to the patient's symptoms and the effect of the medication. So I thank you very much for listening. It was a lot of numbers, and please remember you don't need any overlap with this, so don't give tablets together with this intramuscular injection at the same time. Thank you very much for listening, and bye bye.